Hello, Rockdale County. Sean Kimball here with your weekly COVID report. Today, we're going to be talking to Dan Morgan. He is the director of the Emergency Management Agency here in Rockdale County. He's going to give us an update on the numbers we've been seeing dealing with COVID-19.
Thanks, Sean. Glad to be here. Want to talk quickly about the COVID numbers in Rockdale. Currently, we are averaging about 45 cases per day. This is down very slightly. In fact, we're down very slightly across all metrics over the past week. That is due for us being out of the holiday season, but we are still at extremely high areas according to the metrics for the state. Rockdale is still categorized as a county of high transmission, and we are still seeing increases in infection across all age groups. Our infection rates are 16% across the county from all our testing, and we are still not out of the woods. Now, a way to get out of the woods is to have testing and vaccines. And let me talk about testing. Testing is still available at the Gwinnett and the Newton and the Rockdale County Health Departments, as well as numerous local providers out in the community. The vaccines now are starting to roll out. Still not a lot of volume in the vaccines. It will continue to get better. Right now, it is difficult to make an appointment, and all providers are requiring an appointment. In our community, we are starting to see it at the Krogers and the CVSs and very spotty availability as they start getting their allotments. The majority of the vaccines in Rockdale, Newton, and Gwinnett are still given by the health department. That is GNR, Gwinnett, Newton, Rockdale Health Department. We have a large site at RCA on Parker Road, and you can reach GNR to make an appointment at any one of their sites by going to their website. Now, the frustration is you can only make an appointment if they have confirmed vaccines appointments available, which they do not open up until they have the vaccine. So they are testing about 500 per day. That's only 2,500 per week, but that is a lot more than we were doing 3 weeks ago. So the vaccines are very important for our community to work through this. Get tested, do not go to work sick, wear masks, use hand sanitizer, wash your hands, and use social distancing and avoid crowds. The vaccine is going to help us. We will have more in the future, and there'll be more news coming about more vaccine sites over the next couple of months as the vaccine pipeline opens up.
So Dan, at this time, at my age, I don't think I have the ability to actually get the vaccine yet because of my age. I know that there's different stages. Can you tell me just a short amount about that?
Excellent question. And yes, the vaccine rollout across the nation and in each state comes out in phases. Right now, we are currently at the very beginning of the first phase, which is phase 1A plus. Currently, if you are a medical provider, a hospital worker, a healthcare worker, a first responder, or over 65, you are eligible to make an appointment through any method you can find, private provider or the health department, GNR, at our RCA place. Then the next phase, when we get through 1A plus, which means it's all dependent on how many vaccines we receive on a regular basis, it will go to 1B, and then it will go to 1C, and then it will go to phase 2 and phase 3, and so on. By the time you get to phase 3 and 4, we will be in the general public. I predict that will be late summer. Phase 2, the next round, which will come probably in the next month or so after we finish phase A1, will be essential workers, and that is defined as those people who help society continue to function. That is school teachers, court workers, people who run our water plant, people who bring the food to the grocery stores, those type of essential workers that allow the community and society to continue to function. And then when you get to 1C, it will be those age 16 to 64 who have serious medical conditions that were not included because they weren't over 65. And then by the time they get to phase 2, phase 3, we go more into the general populations as we climb through this. One thing to remember, there is not a vaccine available for anyone under 16. There are no juvenile vaccines available. So we are talking all these phases are for adults. And that's how we're going to do that. There again, the phases are set by the governor, and he decides based on the numbers from the State Department of Health when we are ready, the state ready to move to the next phase, totally dependent on amount of vaccine and how quickly we can get it in your arm.
Hey, thank you so much for that, Dan. It's great information. Folks, these are the numbers, and this is the information that we're getting right now. This could change based on what the governor decides, how much vaccines. Many things could change. These are not set numbers, so please keep that in mind. Continue to visit the dph.org website, where you can get some of the most up-to-date graphs and charts and numbers and information, and give those phone numbers a call with any of your questions that you may have. Don't just take it as, well, I'm not over 65 or I'm not a healthcare worker, so I'm not eligible. Like I said, those things may change. So keep on those phone numbers, and just double check. Make sure you're safe. Make sure that your family is safe. Dan is going to be one of our regular attendees for this weekly COVID report. We also are going to be inviting another doctor in to discuss things with us as we move forward. But until we get these numbers under control and we get a large amount of the population vaccinated, we're going to continue to bring these numbers. We've seen a huge uptick in the infections. I myself was infected with COVID, so I'm really concerned about this. It really brings it close to home. So we want to make sure you guys are informed the best that we can do. And if you have any questions, like I said before, the dph.org website and those phone numbers on that website are a great place to start to get all your questions answered and get them answered by the people that know it the best. So that's all for today. We'll see you next Friday right here on your weekly COVID report.